In this video, we are going to talk about the sequence of events in heart failure. So, what happens in heart failure? In heart failure, there is some cause, there is some primary etiological factor that is actually leading the heart towards failure. This etiological factor, this cause, could be related to pump failure, or it could be related to some overloading issues, excessive preload, excessive afterload. Whatever the reason is there, it will cause some myocardial damage. So, if there is myocardial damage, the contractility of the heart will be impaired. So, this impaired contractility of the heart will cause the heart to, to invoke some compensatory mechanisms. These compensatory mechanisms are actually also called as cardiac reserves. These cardiac reserves helps the heart to manage the situation. At this point of time, when there is some compensation going on, there will be little symptom because the heart is compensating the problem. But if the cause, which could be pump failure, which could be overloading issues, if it's still there will be excessive compensation, right? So when there's excessive compensation, a time will come when there will be decompensation. Now the heart is has gone towards decompensation, or the heart has now gone towards maladaptation. There will be some changes that will happen in the heart. This will actually cause in a wide range of symptoms now, right? So there will be more symptoms now. So when the decompensation has happened, this decompensation is actually contributed towards more myocardial damage now, because the heart is not compensating now. It's now in decompensation state. So there will be more myocardial damage. More myocardial damage, more impaired contractility. More impaired contractility, more symptoms. So this is a general events, the general sequence of events that are happening in the case of a heart failure. So hope you understand a general overview of it. So if you like the video, don't forget to like, share, subscribe, ParmCept. Thank you.